Huntington's chorea, also known as Huntington's disease or HD for short, is a fatal neurodegenerative disorder that progresses over a 10 to 20-year period, eventually depriving a person of their ability to walk, talk, think, and reason. Chorea, the ancient Greek word for dance, refers to the characteristic writhing and dance-like motions caused by the loss of neurons in the disease. HD was first described in medical literature in the 1840s as chronic hereditary chorea. In 1872, George Huntington published a landmark paper on chorea, which described HD symptoms and emphasized its genetic nature. Around 1910, scientists pinpointed the caudate nucleus as the main region of cell death in HD, and 60 years later, researchers discovered low levels of GABA, an inhibitory neurotransmitter in HD patients. However, the most important discovery came in 1993, when scientists discovered a gene marker linked to HD on the short arm of chromosome 4, a gene now known as HTT. In HD, an inherited mutation causes an abnormally high number of CAG repeats in the HTT gene, also known as an expanded triplet repeat. CAG codes for glutamine, causing the resulting Huntington protein to have an overabundance of glutamine and leads abnormal links to form in the protein. The result is a mutated Huntington protein that isn't functional and instead develops into a tangled, rigid grouping known as a protein aggregate. These aggregates clump together and trap molecules that cells like neurons need to function normally. This commonly results in cell death, especially in the basal ganglia of HD patients. Cell death in HD tends to target GABA-releasing neurons in the caudate nucleus and putamen of the basal ganglia. Since these areas are primarily responsible for inhibiting movement, their degeneration causes involuntary movements or chorea in HD. Huntington's disease comes from a dominant mutation of the HTT gene, meaning that a child with a parent with HD has a 50% chance of inheriting the mutation and being infected. However, in roughly 10% of cases, the HTT gene actually mutates on its own. HD affects nearly 30,000 people per year and places another 200,000 at risk due to its genetic component. As a result, it's now considered one of the most common hereditary brain disorders. It normally affects those with a family history of HD and strikes in middle age, around 30 to 50 years old, though early onset versions of the disease do exist and can be devastating. While HD affects people across the world, it appears more frequently in individuals of European descent. Loss of neurons in the basal ganglia, the region of the brain that facilitates voluntary movement, causes the involuntary jerking and writhing movements characteristic of HD, or chorea. It also results in other motor symptoms, such as muscle rigidity, dystonia, or involuntary muscle contractions, slow eye movements, impaired gait and posture, slurred speech, and difficulty swallowing. It also causes cognitive and psychiatric symptoms like difficulty planning and focusing, lack of impulse control, slowness in thought processing, and difficulty learning information. It also causes irritability, depression, apathy, insomnia, fatigue, and even suicidal thoughts. Currently, there is no cure for Huntington's disease. However, some drugs and therapy can lessen motor and psychiatric symptoms, though they are far from perfect. For example, the drug tetrabenazine can help suppress involuntary movements, but runs the risk of worsening or even triggering depression. And while antidepressants like SSRIs can treat psychiatric symptoms, they often cause nausea, low blood pressure, and drowsiness. On the other hand, antipsychotic drugs like Haldol and chlorpromazine can also be used to treat chorea, but they can worsen muscle rigidity and dystonia. Meanwhile, psychotherapy, speech therapy, and physical therapy are useful in managing motor and psychiatric symptoms of HD. Furthermore, the recent development of CRISPR and similar gene editing tools shows promise in finding a cure for HD. To continue supporting the search for a cure for Huntington's disease, visit hdsa.org for more information.
Created using Powtoon.